Are you noticing more hair in your brush than usual? Well, you are not alone, and there are ways to help. Hi everyone, I'm Dr. Weinstein, a board-certified dermatologist. And today we're talking all about preventing hair loss and regrowing fuller, thicker, healthier hair. So first, let's get into the reasons why hair loss even happens. So there are really four main reasons why you can experience hair loss: genetics, stress, hormones, and nutritional deficiencies, and also medication sort of clump into that category as well, like chemo medications, but that's a whole different topic. So first of all, let's talk about genetics. Genetic causes for hair loss can affect both men and women. In fact, 50% of men over the age of 50 will experience some sort of hair loss related to genetic causes. And 20% of women by the age of 35 will also experience some sort of hair loss related to genetic reasons. In men, a genetic pattern of hair loss is pretty recognizable, and we're probably familiar. Men lose hair at the crown of the scalp or the vertex area, and they maintain hair within that lateral fringe. In women, the pattern is different and interesting actually. They'll maintain the frontal hairline and have thinning, diffuse sort of thinning in the crown or vertex area, and it usually remains full thickness in the back. So similar pattern, but women maintain that frontal hairline. Now, the great thing about both of these types of hair loss is that they are not a scarring type of hair loss, which means there are ways to prevent the hair from getting worse or appearing more thin. Now, how do you know if you might be subject to a genetic pattern of hair loss? Usually it stems from the maternal grandfather. So if your mom's dad had hair loss, then you or someone in your immediate family are more than likely going to experience some form of genetic pattern hair loss. Now, knowledge is power, right? So if you know that and you're starting to see these patterns evolve on your scalp, then it is time to think about ways to get help. For genetic inherited type hair loss, there are many different things that you can try and take to prevent the onset or prevent the worsening of that hair fall. The second cause of hair loss is stress. And this is probably one of the most common reasons why we see hair starting to shed. Now, stress-related hair loss is also known as telogen effluvium. And basically that means that the shedding phase of your hair cycle is prolonged, which means that instead of shedding the hair every 3 months through the normal growth, rest, shed phases, you shed for longer than you normally should. And so your hair remains in that telogen phase, and it can be kick-started by a lot of things related to stress. So a stressful life event, a move, a death in the family, an illness, some sort of trauma, an accident, all of those things can kickstart a phase of telogen effluvium. And the good thing about telogen effluvium, similar to genetic pattern hair loss, is that it's non-scarring. And even better, if you have telogen effluvium and you catch it early and you can pinpoint the stressors that might have started it, you can gradually over time reverse all of those things and regrow your full head of hair. So that is excellent news. Now, hormonal changes can also be sort of intertwined into the stress and genetic related causes. And typically these causes for hair loss are also non-scarring. So the great thing about everything I'm saying is that if you start to experience hair shedding or loss or thinning in any sort of way, most likely that hair can be recovered when intervened early on. So hormonally, there are different medications you can take to help block that androgen effect that contributes to hair loss. And also with nutritional deficiencies, there are blood labs we can check in the office to make sure that there are no underlying internal causes that can lead to hair loss, like vitamin D deficiency, iron deficiency, thyroid disease, anemia. All of these things can contribute to hair loss. So it's important, if you're starting to notice more hair fall, to make sure you take a 360 view of what's going on in your life, where your genetic inheritance lies, and what might have changed in your system internally so you can pinpoint what's causing that external manifestation, aka hair loss. Now, as I mentioned, there are two main types of hair loss if you want to clump it into two major categories, and that is scarring versus non-scarring. So a scarring alopecia can occur from many other different conditions, far too many for the context of this video, but if you're interested in learning more about those, we can certainly dedicate another video entirely to scarring alopecias. But of course, with scarring alopecias, once that hair is gone, the follicle closes, scars down, and it's very difficult difficult, if not impossible, to regrow hair through those scarred areas on the scalp. Now, all of the other things that we've discussed today so far are types of non-scarring alopecia. So those follicles are still intact and you should still be able to regrow your hair, albeit it might not be as dense and full as it once was, but you should still be able to regrow hair, and that horrible fear of becoming bald or losing all your hair should be washed away immediately if you do not have a scarring form of alopecia. Now, the one thing we didn't discuss is an autoimmune type of hair loss called alopecia areata, and that is a non-scarring type of alopecia, but that's when you get big circles of hair that falls out in chunks, and it usually is in a circular type pattern. You can also develop alopecia universalis, which means all of the hair on your entire body falls out, or there's a condition called alopecia totalis, which usually just the hair on the head and neck area falls out. Now, this is all related to autoimmune conditions and can also coexist with things like thyroid disease, asthma, and allergies. But if any of these things I just described are happening to you, then you definitely need to get into your primary care doctor, to your endocrinologist, and to your board-certified dermatologist to do a thorough workup and make sure that we know the underlying cause of your alopecia areata, and therefore start to employ some techniques to treat early on. Now, just in general, some tips to prevent hair loss, things that you can start doing today. So the first thing is hairstyling. I know this is sort of like something we never think about, right? But repeatedly putting your hair into tight hairstyles, or the Ariana Grande bun, or slicking it back with making sure that there are no wispies, which clearly I didn't do today, but things like that, maintaining tight hairstyles can definitely lead to thinning of hair, especially along the frontal hairline. There's a type of kind of overlap scarring and non-scarring alopecia called traction alopecia, and that can ensue from repeatedly pulling the hair back. So even if it's in braids or a bun or a high pony, that is okay to do sometimes, but every day or every night to sleep or always wearing a heavy extension can definitely wreak havoc on the scalp, creating a lot of tension and therefore leading to a condition called traction alopecia. Now, this is reversible, but it's important to know that it's preventable. So if you just switch up your hairstyles often, then you won't be subject to developing this sort of band of baldness, really. It looks like a headband of very thin, broken hairs. Other things to definitely avoid are excessive heat and harsh chemicals. So oftentimes people get into these routines where they are blow drying the hair every day. And if that's you, make sure you're using a heat protectant all the time, but maybe explore some hairstyles that don't involve applying heat every day. For example, in the summer, maybe you wear more of a natural hairstyle, and in the winter, maybe if you want to maintain a blowout here and there, then that would be okay too. But again, switching it up so that your hair isn't subject to repeated heat or repeated chemicals. So chemicals could be relaxers, for example. Those of us with more ethnic hair, more kinky, coarse, curly hair might be used to using relaxers, which help kind of smooth the hair and keep it straight. But relaxers have a lot of harsh chemicals in them that can actually damage the follicle at the root. And so it's important to know that if you are using relaxers, maybe you alternate, maybe you just do them seasonally, but not all the time, and look for the ones that are formaldehyde free and gentle on the hair. Other prevention techniques, so we talked about nutritional deficiencies leading to hair shedding or thinning. Some ways to get around that are to make sure you're eating a well-balanced diet. So something consisting of leafy greens, lean meats, colorful foods, fruits, things with low glycemic indices. So things that don't spike your sugar or insulin levels quickly. Foods that are big no-nos are packaged foods, candies, baked goods, white bread. All these things that have bleached flour and preservatives can definitely affect your overall health. And not only will you notice your hair doesn't look as healthy and it might be thinning a little, your skin might not be as dewy or as hydrated. And of course, we talked about managing stress. So making sure that if there is a surgery upcoming or a stressful life event that you can anticipate, that you do all the things prior to sort of prepare your system for that. Get lots of rest, seek help from a therapist, talk about things that might be bothering you or things that might be upcoming. Now, if there's a traumatic event or just something that you couldn't plan for, then obviously we're going to backtrack and try to put all the plugs in place to prevent massive hair shedding. But anything you can do early on to sort of manage your stress, exercise, again, eating healthily, sleeping well, can all help manage stress stress and therefore reduce those cortisol levels in your system to prevent that shock to the scalp. I always say with stress, people handle it so differently. So sometimes people get palpitations, some people get IBS or irritable bowel syndrome, some people gain weight, they lose weight, some people break out, and some people lose hair. So that's just, hair shedding is just one of the many ways that our body can respond to stress. Now, there are some over-the-counter evidence-based treatments that you can start before you're able to access a doctor or you're waiting for your appointment. One amazing ingredient out there is Minoxidil. So Minoxidil over the counter comes in a topical form, either a liquid or a gel. And what it does is help hair stay in that growth phase or the anagen phase. So if you're noticing the hair shedding at a more rapid rate, when you start Minoxidil, it will help halt that process and get all of your hairs into that growth phase and leave them there. Now, if you use it sometimes, it's obviously not going to work. Or if you use it initially and start to notice the hair regrowth and then stop, then the hairs that were going to fall out are going to fall out anyway, because that plug of keeping the hairs in the growth phase is no longer in place. Minoxidil receives a bad rep in some ways because people say if they use it, it makes their hair fall out, or if you stop, or you have to use it for life. All of these claims are just Minoxidil being misunderstood. The correct way to use it is to use it nightly and regularly. At least give it 3 months so that you can get over the hump of that telogen effluvium phase or whatever it is your body is going through that initially started the hair shed. Or even use it daily until you're able to see your board certified dermatologist or your primary care doctor. And at least you gave it a fair chance. There are also some in-office prescription medications that can help regulate your androgen productions or your hormones, like finasteride and spironolactone. And these are things that when you come into the office, we determine whether or not they're appropriate for you. Typically in men, we prescribe finasteride early on if that's of interest to patients, though there are some sexual side effects that are less than desirable, but some people prefer to take the chance to maintain the hair on the scalp. And oftentimes it's not that common, although if it does happen to you, then obviously you can choose to stop. And there are other treatments that we can try that are available. There are also many wonderful in-office procedures that we can do, like PRP, microneedling, exosome application. And these are all things that we talk about in the office when we talk about A, why you're losing hair, and B, what we should do to maximize hair regrowth. And lastly, Claire, let me just debunk some myths for you. So shampooing more frequently or less frequently does not contribute to hair loss or hair growth. You'll notice that nowhere in this video did I mention that you should only shampoo once a day or once a week or however it is. Your shampooing should be a personalized experience for what your scalp and your hair need and what makes your hair and scalp feel good and healthy. People who have very oily scalps might need to shampoo every day or every other day. People who have drier scalps or hairstyles that can be maintained without washing, maybe wash once or twice a month or once a week. So there are so many different intervals, and none of these intervals will affect whether your hair sheds faster or grows faster directly, so long as there are no underlying pathologic scalp issues. Next myth, supplements only help if you have a deficiency. This is completely false. Hair loss supplements are, in my opinion, are holistic supplements. These can be used whether or not you're having hair loss issues or not, or whether you have nutritional deficiencies or not, because in many of these supplements, there are so many different vitamins that are mixed together and are studied together to be effective to help give your scalp what it needs to nourish the follicle in order to regrow hair. Now, if you're not iron deficient, then you don't need to take a big hunk of iron every day. But if you look for a holistic hair loss vitamin like Nutrafol or Viviscal or Hair, Skin, and Nails by Nature Made, then these can all be appropriate vitamins to take whether or not you're deficient in any one category. Now, lastly, natural remedies aren't always safe and are more effective. That is true. There are so many different DIY videos and natural remedies out there. And again, this is such a personalized thing. If it's working for you, then continue on. But if you're trying castor oil or rosemary oil or pumpkin seed oil and you get a reaction to it or scalp starts itching, that means that it's probably not the right product for you. There can be some limited evidence that maybe some of these have anti-inflammatory properties or can help stimulate the follicle. But if you try it and it's not working for your scalp, then definitely stop. Natural is not always better. Hair loss can be so frustrating frustrating. I get it. I hear it every day, but you don't have to face it alone. With the right diagnosis and treatment plan, hair regrowth is entirely possible. Comment with your biggest hair question below, and don't forget to like, subscribe, and share this video for some more dermatologist-backed skin and hair care tips.